Hello, and thank you for joining me today. I'm glad you're taking the time to learn more about your health. Today, we're diving into a common health issue that affects many men as they age: benign prostatic hyperplasia, or BPH. It's a condition that's important to understand. BPH is a non-cancerous enlargement of the prostate gland. It's not cancerous, but it can certainly cause some bothersome symptoms. The prostate is a walnut-sized gland located just below the bladder in men, and it surrounds the urethra, the tube that carries urine out of the body from the bladder. Think of it as a critical part of the urinary system's plumbing. As men age, the prostate often grows larger, a process that's quite common, squeezing the urethra like a clamp on a hose, restricting the flow, making urination difficult and sometimes quite frustrating. BPH is extremely common. It's a widespread condition. It affects about half of men in their 50s, a significant portion of this age group, and up to 90% of men over 80. So, as you can see, it becomes increasingly prevalent with age. The main cause? What's behind this enlargement? Hormonal changes play a key role, especially the accumulation of DHT or dihydrotestosterone, a form of testosterone, as men get older. This hormone can stimulate prostate growth. Remember, and this is crucial, BPH is not prostate cancer. They are two distinct conditions. And having BPH doesn't increase your cancer risk. It's a common misconception, so it's important to clarify. The symptoms can overlap with other conditions, so it's important to see a doctor for a proper diagnosis and to rule out any other potential issues. BPH is a manageable part of aging for many men, and there are effective treatments available. Understanding what's happening in your body is the first step to taking control of your health and making informed decisions about your care. If you're experiencing urinary changes or any of the symptoms we've discussed, don't ignore them or dismiss them as just a part of getting older. Early awareness and proactive management can make a big difference in your quality of life. Let's look at the symptoms you should watch for so you can be better informed and take appropriate action. BPH symptoms mostly affect urination due to pressure on the urethra. You might notice a frequent need to urinate or urgent need to urinate, especially at night, called nocturia. Starting urination can be difficult and the stream may be weak or stop and start. Straining, dribbling, and a feeling that your bladder isn't empty are also common. These symptoms can disrupt sleep and daily life. The severity doesn't always match the size of the prostate. Mild enlargement can cause major symptoms. If you notice these signs, talk to your doctor. Don't dismiss them as just a normal part of aging. Early action can prevent complications. If you're experiencing symptoms related to your prostate, such as frequent urination or difficulty emptying your bladder, your doctor will start with a thorough discussion, asking questions about your medical history and overall health. They'll want to understand any pre-existing conditions or medications you're currently taking. They'll also delve into how your symptoms specifically affect your daily life and well-being. A physical exam is a standard part of the evaluation, and this often includes a quick digital rectal exam. This allows the doctor to directly check the size, shape, and feel of your prostate gland, helping to identify any abnormalities. To rule out a possible infection or other underlying issues, you may be asked to provide a urine sample for testing. Additionally, a blood test will likely be ordered to measure your PSA levels. PSA, or prostate-specific antigen, is a protein linked to prostate health, and elevated levels can sometimes indicate BPH or other prostate conditions. In some cases, further specialized tests may be recommended, such as measuring the rate and volume of your urine flow. Another test involves checking how much urine remains in your bladder after you've emptied it, providing insights into bladder function. These tests are generally simple and non-invasive, and they play a crucial role in confirming a diagnosis of BPH and helping to rule out other potential causes of your symptoms. The ultimate goal of these evaluations is to accurately identify the underlying cause of your symptoms and to develop a personalized treatment plan that is tailored to your specific needs and circumstances. Throughout this process, don't hesitate to ask your doctor any questions you may have. Understanding your treatment options, including their potential benefits and risks, is absolutely key to making informed decisions about your health. Next up, let's delve into the various strategies for effectively managing BPH and alleviating its symptoms. BPH treatment depends on the severity of your symptoms and how much they're impacting your daily life. It's also important to consider your overall health and any other medical conditions you might have. Ultimately, the best approach is a shared decision between you and your doctor, taking into account your individual preferences. For mild cases where symptoms are more of a nuisance than a major problem, lifestyle changes can often provide significant relief. One simple step is to limit fluids, especially in the hours leading up to bedtime, and it's also wise to cut back on bladder irritants like caffeine and alcohol, which can worsen urinary symptoms. Another helpful technique is double voiding, where you try to empty your bladder completely, wait a few moments, and then try again. Staying active with regular exercise and maintaining a healthy weight can also support overall prostate health and potentially alleviate some BPH symptoms. If these lifestyle adjustments aren't enough, and symptoms persist or worsen, then medications are often the next step. Alpha blockers work by relaxing the muscles in the prostate and bladder neck, which makes it easier to urinate and reduces the feeling of urgency. On the other hand, 5-alpha reductase inhibitors actually work to shrink the prostate gland itself, although this process takes time, usually several months to see noticeable results. Sometimes, to achieve the best possible symptom control, both types of medications are used together in a combination therapy approach. In more severe cases, or when medications aren't providing enough relief, there are a range of procedures including the traditional TURP and newer minimally invasive options such as UroLift or Rhizome, which offer different ways to relieve the blockage caused by an enlarged prostate. All of these procedures aim to relieve the blockage, improving urine flow, and reducing bothersome symptoms. These treatments are generally very effective at improving quality of life, and in most cases, recovery is usually quick, allowing you to get back to your normal activities sooner. Your doctor will carefully explain all the available options, helping you weigh the potential risks and benefits of each one. Remember, there's no need to suffer in silence or feel embarrassed about discussing these issues. Effective help is available, and you don't have to live with the discomfort and inconvenience of BPH. Beyond treatment, let's also discuss strategies for prevention and maintaining long-term prostate health. Ultimately, it's about taking charge of your well-being and working with your doctor to find the best path forward. While you can't change your age or genetics, a healthy lifestyle supports prostate health. Eat a balanced diet rich in fruits and vegetables, and healthy fats, and exercise regularly. Obesity increases BPH risk, so weight management matters. Untreated BPH can lead to infections, bladder stones, or even kidney damage in severe cases. Emotional effects, like stress or embarrassment, are real, but you're not alone. Talk to your doctor and reach out to loved ones for support. BPH is common and manageable. With today's treatments, you don't have to accept discomfort as inevitable. Take the first step, get checked, explore your options, and regain your quality of life. You can live well with BPH.